All kids count. That's the name of a major focus of our health department. In 1994, the immunization level of 2-year-olds in our city was 37%. By the end of this year, the health department hopes to reach 60%. The ultimate goal, to reach 90% of all 2-year-olds by the year 2000.
Babies need immunization against 9 serious diseases. Those are 9 good reasons in themselves. But you only need one reason: your child's health.
With the immunizations, the diseases are pretty much knocked out. You don't really have to worry about them so long as you get them immunized on time and you keep up with it. Because if they miss their immunizations or if they don't get them consistently, they're going to get sick. And the diseases are a lot scarier. Most of these diseases can kill a child. People think of the childhood diseases as harmless, like chicken pox or measles. Well, those are just harmless. They're not. They're frightening if you see them.
5 immunizations protect against 9 childhood diseases. MMR to protect against measles, mumps, and rubella. DTP to guard against diphtheria, tetanus, and whooping cough. An oral polio vaccine, the HIV vaccine to defend against meningitis, and hepatitis B to protect against liver infection.
4, 5, 6, 7, 8, 9, 10, and we're done.
Yes, it can hurt a little, and youngsters can and do cry for a few minutes. If your child is old enough to understand, explain that vaccinations can prevent some very bad diseases. If your child is younger, comfort and play with your baby. Reward your child after the vaccination. The Milwaukee Health Department wants to see all children in Milwaukee immunized. What we don't want is a repeat of what happened a few years ago. There were thousands of measles cases yearly prior to development of a measles vaccine in the 1960s. With a heavy emphasis on immunization, the numbers fell dramatically in the 1980s. But for some reason, after nearly a decade of few reported cases, Milwaukee saw a major measles outbreak in 1989 and 90. Most of those happened to infants and children during the school year. 1 in 5 was sick enough to be hospitalized, and 3 preschoolers died. A comprehensive new program called All Kids Count grew out of that serious epidemic. Its goal is to achieve full immunization of all children in the birth to 2-year age group by the year 2000. The All Kids Count program and a renewed emphasis on immunization brought the measles cases down again. But unless the effort continues, an epidemic could happen again.
We could have another measles epidemic tomorrow, we think. The levels have started going up. They're certainly not up to the 90% that we think that they need to be. And what we're trying to do with a lot of our programming is introduce changes in the healthcare delivery system that will stay on forever. So that we'll raise levels right now, and then these changes in the healthcare delivery system will ensure the levels stay high.
Success can depend on availability. So the All Kids Count program has also focused on providing expanded hours at immunization clinics and mobile vans, along with increased educational efforts, including immunization materials in English and other languages. So don't wait. Vaccinate. Protect your child with a preventive medicine. Life-threatening diseases exist that are just too powerful to fight without vaccines. Remember to begin your child's schedule of vaccinations at the time of birth. But if your child is older and has not followed the recommended schedule, don't give up. Contact your doctor or health department. And don't forget, it's the law. Wisconsin immunization law requires that children in licensed daycare centers and students through grade 12 be immunized against the spread of disease. Fines or other actions can be imposed for noncompliance. Finally, while immunization is extremely important, it is only one part of a child's total health care. Make sure you have a doctor or clinic where they know your child, and be sure to get regular checkups even when your child is healthy.
Childhood lead poisoning gets a lot of attention in our health department since Milwaukee's problem exceeds the national average. Each year in our city, about 1,500 Milwaukee children are identified as lead poisoned. And so the Milwaukee Health Department has an aggressive screening and prevention program.
All right. It'll be all right, huh? Take your little toy, huh? Ooh, isn't that cute, huh? Take your little bird. See your little bird? You see bird?
A simple finger stick and a few drops of blood. That's all it takes to find out if your child has lead poisoning. Even a small amount can affect how well he or she behaves or can learn. Higher concentrations of lead can cause major health problems. They include brain damage, nervous system and kidney disorders, vision or hearing loss, and can even be fatal.
Now, it'll take this test from 10 to 14 working days before it come back. But when it do come back, if it shows he got higher than a normal lead level, the lab or either the nurse in the area will let you know.
Children should first be tested for lead in the blood between 6 months and 1 year of age. If high amounts of lead are found, you should seek treatment and have your home tested for lead-based paint and lead dust by a qualified contractor or city inspector. Peeling, chipping, and chalking lead paints are the main culprits in Milwaukee, especially on and in older homes painted before lead paints were banned.
I look for signs of chipping and peeling paint, signs of deterioration such as chalking. I look for any possible holes, and then suspect it's containing lead. I put my meter to those surfaces to check for the content of the lead, and the meter will give me an actual number telling me if the quantity is high or low of lead. Once I determine that there's actually lead in that paint and it's defective, then those surfaces will be issued for correction to the owner. Yeah, if a home has been built before 1978, that's the year that lead paint was banned. There's a good chance that it may have lead-based paint on the surface, and especially before like 1960, where concentrations of lead paint were much higher. If the paint is deteriorating on a home that's of that age, you can suspect that it has lead-based paint.
Terrell Hewitt's Southside Milwaukee flat had a lead paint problem, and so did he. High levels of lead were found in his blood during a regular checkup about a year ago. It's youngsters like him, under 6, who are at the highest risk. They play on the ground or floor where lead paint chips and dust may have fallen, then put contaminated fingers and toys in their mouths. Lack of concentration, crankiness, or flu-like symptoms can be signs of lead poisoning. However, like Terrell, a child might not show any signs.
So he didn't have any symptoms of being an ill child or tummy aches or speech?
No, nothing that
Made you
that wasn't out of the ordinary, just a normal child.
Milwaukee public health nurses have been providing home visits for Terrell and his mom, providing basic information, developmental assessments, nutrition advice, and other services. Like the inspectors, the nurses also work to ensure that lead hazards are reduced or eliminated.
The landlord cooperated, and they got the windowsills painted and a lot of the holes and stuff patched up and got rid of the old lead in the paint. Okay, good.
There are a few things that can be done to reduce the risk. Paint chips can be misted and collected with a wet mop and carefully disposed of. Cracking or chalking walls can be washed with a high phosphate detergent, then painted with a non-leaded paint. You shouldn't sweep or vacuum lead-based paint chips or dust with an ordinary vacuum cleaner. A special unit called a HEPA-Vac, specially designed to filter the extremely small dust particles, can be rented. But in many cases, it's best to get professional help.
The experience of the late 70s and the early 80s is that people who try to remove lead leave a legacy of lead dust, which is far worse than the original problem. And so specialized training makes it possible to make the lead safe or to remove the lead from the premises without creating a greater hazard than when you started.
When the problem is serious, total abatement can be an expensive proposition. There is some help available. The health department can share half the cost for certain property owners, up to $1,500. Remember to provide well-balanced meals for your children, foods low in fat, high in iron and calcium. Make sure they wash their hands often and watch what goes into their mouths. And don't forget that regular medical checkup.
Okay, good job, my friend. Now let's see how tall you are.
The aggressive screening program in Milwaukee on children 6 months to 6 years of age is achieved through a public and private partnership of the Milwaukee Health Department and private medical doctors. Over 6,000 children, 1 in every 3 tested last year, were found to have some degree of lead poisoning. While the health department believes it has made a significant difference in the health of Milwaukee youngsters, lead poisoning remains a serious problem, and the effort to reduce the hazards will continue.
Me too, all done, all gone.
Nearly 4,000 Wisconsin women will be diagnosed with breast cancer this year. Early detection and regular screenings are essential in the battle against this disease. The health department offers free mammography screenings, clinical exams, and instructions on breast self-examination.
The statistics of breast cancer can be frightening to every woman. All women are at risk. The risk grows with age. We do not know what causes breast cancer or how to prevent it, but we do know there is hope with early detection.
Well, the significance of breast cancer is that about 1 out of 8 women develop breast cancer in their lifetime if they live long enough to age 85. The risk of breast cancer increases as women age, so as our population is aging, we are seeing more and more breast cancers that are occurring. The progress is basically related to early detection with mammograms.
Early detection is the idea behind the mobile mammography van of the Milwaukee Breast Cancer Awareness Project. Funded by the city, state, and Instrumentarian Imaging, it's aimed at low-income, uninsured, and underinsured city residents. The mammograms are free for those who meet the guidelines. The van takes its mobile equipment and tips on self-examination into the community, allowing the city to get services to women where they live and work.
A standard mammogram consists of taking 4 views for an average-sized patient. And the 2 views we do are called cranial caudate and a medial lateral. The cranial caudate, we're going to place the breast right in the middle of the plate, and we're going to add compression, like so. And we have to make sure that the breast is taut enough between this paddle and the plate so that we don't get any motion on the film. It's going to be uncomfortable, but if you're in a lot of pain, if for some reason you have any pain to the breast, you let the technologist know and we can alleviate the pressure within limits, okay? We also do a side view. You angle the machine. You have to grab onto the bar, and the breast is also placed on the plate sideways. Going to get compression. Sometimes for most women this view is a little bit more uncomfortable, but that's because we're getting tissue from under the arm and the entire breast area.
What is the test all about? Mammography is an X-ray exam of the breast which must be compressed for proper imaging. The radiation dose is comparable to that of a dental X-ray. It is not a diagnostic test for cancer, rather a detection device to find abnormalities that might be cancer and therefore require diagnostic procedures. The vast majority of lumps found are not cancerous. One of the most important judgment calls is made by the radiologist, the person who reads and interprets the mammograms. Dr. John Milbrath is an experienced radiologist who, as an unpaid volunteer, reads all mammograms from the City of Milwaukee's mobile screening program.
Well, it's a way of giving something back to the city. I grew up in the city. I have expertise in an area, and I felt that this was a program that needed a person who was expert in interpreting mammograms to provide this service to the women of the City of Milwaukee. So I started with the program and have continued on because I enjoy doing what I'm doing.
Dr. Milbrath has read the X-rays of more than 8,000 women. About 12% of the tests have showed an abnormality. About 1% were cancers. He says don't be overly concerned if called back for other tests.
If the technologist who does the physical exam detects anything, or if I detect anything at all on the mammogram that I'm concerned about, that patient is then called back for additional studies. Those studies are done in a diagnostic vein in one of the 8 major hospitals in the city of Milwaukee who have agreed to participate in the program.
Even with experience and the best equipment, the mammogram is not 100% effective, so it should be one part of a 3-part plan of action.
There are at least 10%, maybe 15% of cancers that cannot be found on a mammogram but are found only on physical exam. So a patient needs to have a good mammogram, a good physical exam, and we recommend annual mammograms beginning at age 40. And they also need to remember that breast self-exam is important. The breast self-exam is something that is important for women to detect the cancers that may come up between screening visits.
To say a mammogram won't hurt a bit may not be true, but Milwaukee health officials say it is true that this critical cancer screening device could save your life. So with your doctor, set up a plan of action that will include a physical exam, mammography, and self-exam. The most successful method of treatment into the near future remains early detection.
In just over 10 years, the disease known as AIDS has spread throughout the world. There have been over 3,000 confirmed cases here in Wisconsin, about half of those in Milwaukee County. Much needs to be done to prevent its spread and to get people tested, diagnosed, and into treatment. And it's another important program of our Milwaukee Health Department.
Are you at risk for AIDS? The greatest risk remains unprotected sex with an HIV-infected person. That's compounded with the addition of multiple partners. The fastest growing risk category is injection drug users sharing contaminated needles. Over 1 million people in this country are believed to have been infected with the virus that causes acquired immune deficiency syndrome.
We have a worsening fatal epidemic disease on our hands, and no community in this country or anywhere in the world has yet found a way to stop it or even really to slow it down very much. So as much as AIDS in the past couple of years may have sort of dipped a little bit in terms of media attention, it is an epidemic that is worsening, and it's worsening right here in Milwaukee.
According to the Wisconsin Department of Health and Social Services, the number of AIDS cases through September of '95 totaled 3,051, with over 5,100 recorded cases of HIV infection. About half are in Milwaukee County. The number of AIDS-related deaths in the same 12-year period reached 1,765, 187 of them during the first 9 months of 1995. The Milwaukee Health Department is very active in the effort to control the spread of HIV infection. Public health clinics offer some treatment services, but primarily they provide confidential and free testing, diagnosis, prevention, education, and counseling.
We're seeing a decrease in the amount of gay white males that are infected. It shows us, the good news is that real strong educational efforts directed at that population years ago seem to have worked, and we're seeing some effect of that and some decrease in number of cases. The bad news is that we're seeing a shift. We're seeing a shift to women. We're seeing a shift to African American and Hispanic women. And what's very disturbing is if you look at all of our HIV and AIDS cases in the city of Milwaukee, 57, well, we have a lot of, about 10% heterosexually transmitted, but 57% of all of our heterosexually transmitted HIV cases involve IV drug use in some way or another. So I think we have a lot of work to do in that area.
The Milwaukee AIDS Project is the largest AIDS service provider in the state, offering care and support for about 1,200 people. The 10-year-old group provides legal, housing, and other support services, an AIDS library and food pantry,
clean needle exchange program, and a clinic for trial drugs. Its caseload has increased 20% in each of the last 4 years.
Well, the demographics of AIDS in Milwaukee has changed dramatically over the past 5 to 10 years. There is not any question but that we are confronting in this city a multicultural disease that is affecting men and women and children from every walk of life.
While still overwhelmingly a disease of adults, there's a growing concern about HIV and young people. And Nelson says he hopes schools, churches, and parents will do more to educate the next generation about HIV and its consequences.
Adolescents and teens and young adults are more and more at risk, and my worry is that the new waves as we move into this next generation or next decade of AIDS, that the new wave of AIDS will be among much younger people.
An awareness that AIDS is more than a gay man's disease is stressed at such events as AIDS Walk Wisconsin. Tipper Gore, wife of the vice president, served as honorary co-chair of the 1995 event. It drew more than 10,000 people and raised nearly $800,000 to be used for a variety of treatment, prevention, and research efforts.
There's a very common, a very dangerous illness in Milwaukee and elsewhere. It's called hypertension, high blood pressure, and you may not even know that you have it. But the City of Milwaukee Health Department can help you find out and then teach you how to live with it. The Northwest Health Center is the focal point of the Milwaukee Blood Pressure Program, now also known as the Cardiovascular Risk Reduction Program. The change in name reflects a change in direction.
We mostly did just blood pressure screening, referral, and advocacy, but we now have changed our focus and to include the goals of cardiovascular risk reduction education, because we want to get people into the mode of getting back into prevention, doing something in their lives earlier to reduce cardiovascular deaths and mortality.
About 12,000 people a year take advantage of the free blood pressure screening programs offered by the Milwaukee Health Department. That includes this center and the volunteer help of about 24 Central City churches, community groups, and other health providers.
The mechanism of high blood pressure is similar to what happens to water in a garden hose. When the vessels are open, blood flows freely. But when the channel is narrowed, pressure builds up, just as water pressure builds when the nozzle of a garden hose is closed. As the channel becomes smaller, the heart must work harder to pump the blood through the narrowed vessels. Because the heart is working harder, the muscle walls become larger and stronger at first, but because the heart cannot meet the constant demand to pump with more force, muscle tissue becomes overstretched and weak, and eventually the heart may fail.
It is normal for pressure to go up and down throughout the day depending on activities and emotions. While high blood pressure is also known as hypertension, it has nothing to do with personality. So who is at risk, and what is normal? No one blood pressure is normal for everyone. Your own lifestyle, background, age, and overall health can all make a difference. Some lifestyle factors are changeable, some are not.
So one has to really sit down and take a serious look at some of their family background, their medical history. Is there high blood pressure in the family? Things like age, race, sex, and heredity are uncontrollable risk factors, things we can't really do anything about, but we need to be aware of these things, certainly if it's in the family. And then on a more personal side, what about my own self? Okay, taking a look at things like weight and in relation to that, how diet correlates to that, fat and salt intake, my level of physical fitness, how well I manage stress from day to day, do I smoke, use of alcohol, any kinds of things like that. And for those people that are on medication then, is it the right medication for me? Is it doing the job it's supposed to be doing? Just regular follow-up with that to make sure we're getting the best control possible.
Blood pressure consists of two numbers. The higher number, or systolic pressure, taken as the heart squeezes to pump blood. The lower number, or diastolic pressure, when the heart relaxes. The desirable level for adults is a systolic reading of less than 130. a diastolic reading less than 85. Higher readings are rated as high normal, high risk, and severe risk. A diagnosis for high blood pressure is made when a series of readings are consistently above the normal level. Recommendations can range from retesting at regular intervals to immediate medical care. If readings are abnormal, the health department offers a number of follow-up services.
What we've done is develop a medical resource sheet which lists medical sites which we can refer people to, whether they're uninsured, underinsured, or even if they have a medical coverage but they just don't know where to go for medical care, we will then be an advocate to get them into the proper medical care facility. If you don't really know what your blood pressure is, you can be at risk for stroke, heart attacks. You can even have visual problems from high blood pressure, because as you know, high blood pressure has silent symptoms, and that's why it's important to learn all you can about cardiovascular health and to have your blood pressure screened regularly.